Did you know that medications for diabetes might help reduce your risk of stroke? Hi guys, Dr. Lily Johnston. I am here in Ojai, California at the Western Vascular Society meeting, and I wanted to take a minute and bring you an update on the most recent developments in cardiometabolic medicine. And there was a great abstract that was presented in the scientific session this morning, and I wanted to tell you about it. This is a paper from the University of Southern California, and the authors looked at a large nationwide data set, and they took patients with a diagnosis of diabetes and carotid artery stenosis, and they stratified these patients by the medications that they were on. So they took 3 different cohorts. One was on GLP-1 receptor agonists. This is like Wegovy and Mounjaro. And then they had a second group on SGLT2 inhibitors. These are medications that help the kidney excrete sugar from the urine. And those are medications like Jardiance. And the final cohort were patients on insulin. And they compared how these patients did over time after they did some propensity matching to try and reduce the confounders about who might get which medication. And what they found is that those patients who were on the GLP-1 receptor agonists had a significantly reduced risk for overall mortality and also stroke. This was significant in patients with asymptomatic disease and those patients that they felt had symptomatic disease or a diagnosis of stroke within 6 months of their diagnosis. So this is really powerful, not so much because it's a flawless study, but really because it underscores the ongoing signal that we are seeing about the importance of cardiometabolic risk mitigation, reduction in the management of vascular disease, right? The STRIDE trial showed us that the GLP-1 receptor agonist could improve walking distance in patients with PAD and claudication. And now we have this new paper that will hopefully come out in the near future that's going to demonstrate that management of cardiometabolic risk really has significant impact on carotid artery disease as well. So I just wanted to congratulate the authors on a really interesting study that really furthers our belief that this cardiometabolic medicine thing is real and it is here to stay. We are out to put ourselves out of business as surgeons and try to mitigate that risk so that patients never need these operations. All right, drop questions and comments in the links below.